My name's Tyler Weiss. I'm a respiratory therapist at Rush University in Chicago, and more specifically, I'm the Director of Clinical Education for the Master's Program, Master's Respiratory Care Program at Rush University. I graduated with my Master's of Science in Respiratory Care in 2014, and then shortly after graduating, I actually joined the PhD program at Rush, and I am hopefully finishing this year. What I like best about my role as an educator is watching the students grow. I'm in an entry-level program where these students are coming in with very little to maybe no knowledge about respiratory therapists and what we do. And by the end of the program, you're seeing them making these critical decisions, critically thinking. They are running mechanical ventilation. They are making impacts on patients' lives. And that, to me, is one of my favorite things to see, is watch the students actually grow and become the future of our profession, really. Yeah, being an educator is a little different than being a bedside therapist, in the sense that the stakes aren't as high because you're not taking care of a critically ill patient. I'm a clinician at heart. At the end of the day, I still get to be a clinician because I get to impart a lot of my experiences to these students, and I get to sort of relive a lot of the times at the bedside. I would not be where I'm at today without my mentors. They really just provided me support. They provided me advice. They opened some doors for me. They provided opportunities. And again, it's not like I just asked for these opportunities. There was like, here, just take it. I had to prove myself to them before they opened up the doors. A few to mention are Brady Scott, David Vines, Ellen Becker, Jay Lee. And when I first graduated, I actually went into Brady's office and I said, I want to be like you one day. What do I need to do? A young respiratory therapist just graduating, coming into their office saying, what can I do to eventually be like you? And actually taking me under their wing and providing me those opportunities is insurmountable. They're still my mentors this day. They'll be my mentors for the rest of my career. And I cannot express the value of having a good mentor in your life. What is my greatest accomplishment so far as an RT educator? I think there's maybe a couple. One is probably my greatest, I think, is watching the students that you have educated go out into the field and do fantastic work. Take care of sick patients and make impacts on patient outcomes, and just constantly hearing that feedback of, man, your students are on another level, and we're so happy to have them. That is just, and that's not just due to me. That's due to our all the faculty at Rush. But I think that is one of the best accomplishments as a faculty and an educator, seeing those students succeed. So advice I'd give to others that have an interest or maybe an interest in RT education is, one, find yourself a mentor if you don't have one already. And specifically, if you have a mentor or someone that you could see yourself maybe wanting to pursue that career path, reach out to them. Ask them about the things that they did to get to their position. Their advice, again, is invaluable. And also take any little opportunity you have to start educating, whether it's at the bedside. Any informal education just helps you hone your education skills, and then it might just snowball into something more formal down the line.